Meanwhile, my colleague Cheryl Tan found out that several private clinics here have been seeing a demand for Sinovac and Sinopharm vaccines as booster shots for reasons including preference for traditional non-mRNA vaccines. This comes as Singapore continues to see rising COVID-19 cases, and starting yesterday, those between 50 and 59 years old can get their boosters. The expert committee on COVID-19 vaccination is still studying the possibility of mixing vaccines for the booster dose. Joining me now is Dr. Alvin Neo. He's the head of clinical projects at Northeast Medical Group. His clinic has been receiving calls about getting non-mRNA boosters. Welcome to the show, Doctor. Doctor, what are some of your patients' reasons for wanting non-mRNA boosters?
Thank you for inviting me. So I think there are a couple of reasons that we have encountered, or rather some of the reasons that patients have come forth to tell us about. So I think firstly, being an inactivated vaccination, the Sinopharm vaccination, the public impression is that it is safer as it has been produced with more traditional vaccine technology. Secondly, there has also been lesser reported severe side effects with the inactivated vaccinations, such as anaphylaxis or myocarditis as compared with the mRNA vaccinations. Although I must qualify that currently all the vaccinations currently available in Singapore are very safe in the sense that the incidence of severe side effects with all the vaccinations currently available have been very low. Thirdly, I think there is also the theoretical benefit of broader coverage if we mix vaccinations, even though this has not been clearly proven in clinical studies currently.
Doctor, I understand that a Northeast Medical offers Sinopharm for primary doses, but not as a booster. Why not, Doctor?
So currently, the Ministry of Health of Singapore has not officially approved the use of Sinopharm vaccination as a booster. mRNA vaccinations are still currently recommended by MOH as boosters for people above 50, as well as for individuals who are immunocompromised. So I believe this is because the current evidence still shows that the mRNA vaccinations have a higher efficacy and protection rate against the COVID-19 virus. Another point to note is that if one does go for a Sinopharm booster vaccination, this individual will then not be eligible for the Vaccine Injury Financial Assistance Plan, or VIFAP, that is being offered by the government currently.
Separately, Doctor, it was reported last night that a 65-year-old woman was hospitalized after taking ivermectin on the urging of her friends to protect herself from COVID-19. What is ivermectin, and is it readily available here?
I think that is unfortunate. So ivermectin is an anti-parasitic drug that is typically used for worm infections. So it has not been proven to treat COVID-19, neither has it been proven to prevent one from getting COVID-19. So some of the severe side effects that one may experience from taking ivermectin include developing a fever, severe joint pains, lymph node swellings, or generalized weakness. So in terms of the availability of ivermectin, it is available in Singapore, but it is a prescription item and it actually cannot be procured over the counter, say in a pharmacy like Guardian or other retail pharmacies.